For the last 5 years, I've been suffering from chronic back pain. Again and again, I've tried to get help from GPs and back specialists. I've taken all kinds of drugs, naproxen and Dolobit, Flexeril, aspirin and Valium. But in the long term, my back pain has always returned. For quite a while, I was resigned to my fate. But I've changed my mind. I'm too young to have chronic back pain for the rest of my life. So if conventional medicine can't help me, I have to find an alternative one. But I just don't know much about it. What should I choose? Who can I trust? I've heard about a fair called Mind, Body and Soul, where hundreds of healers are presenting their therapies. With more than 1,000 workshops, I surely will find something here.
Okay, lean forward. No, sit back. Relax.
Interesting.
How do you feel?
Oh, yeah. What should I normally do to keep it more in balance?
You need more recharge energy because you need more heat treatment.
More treatment. Okay. So far, the solutions are either more treatments or paying a lot of money for a unique gadget.
We're going to use this little machine here. This machine measures thought, the energy of your mind.
Okay.
Okay? So what I'd like you to think about is about your life and people and situations in your life that give you problems or stress, okay? And you look here too. Yes, what did you think of there? What's that thought?
I was just trying to think about, I didn't know exactly what to think, but did I think about somebody, a person?
Well,
or?
you've got a reaction here. Now,
Yeah.
this will act on a very specific thought, and I want to try to identify what that thought is.
Okay.
And we would use the technique outlined in Dianetics to help you access that stuff that, you know, the reasons why that affects you in a negative way.
Wow. It moves quite a lot.
It depends on what
On the
concept-
thoughts.
Yeah, exactly.
Okay.
Okay.
Okay, thank you very much.
Very welcome.
Thanks.
Yep,
Bye.
okay.
It was just moving all the time when we were talking.
There's a whole science behind it.
Yeah.
Information on the chakras, the centers. You know, you can become your own doctor even.
This can't be it, can it? I think I have to learn much more about alternative treatments. So maybe the best thing to do is to ask somebody who really knows what he's talking about. I've heard about the eminent pharmacologist, Professor Colquhoun. During his 30-year career at the University College London, he has done extensive research into complementary and alternative medicine.
One has to be equally critical about any form of treatment. Well, there's treatments that work and there's treatments that don't work. If they work, then they're not complementary or alternative, they're just medicine. If they don't work, then they should be dumped. Simple as that, I think. I just call it alternative medicine. The complementary bit is a sort of propaganda term invented by its proponents to pretend that they're sort of part of the regular system when, of course, they're not. But people are very bad at distinguishing causality. If they have taken a pill and especially if they paid a lot of money for the pill, they're going to attribute any change to the taking of the pill, not to the passage of time. I mean, this is just mind-bogglingly, mind-numbingly stupid, and anyone can see that. It didn't have
I
to
can
be
see his
sort of
point, but
extreme case.
the pills the doctors gave me did not work either. I would like to keep an open mind. So what's next? It is said that faith can move mountains. So why not remove my chronic back pain? The religious guru Stefan Turov has a psychic surgery in an outbuilding of the Miami Hotel in Essex. He claims to be the reincarnation of a Christian saint. Despite charging £25 for a 10-minute session, he's booked out for several months. Can I come in?
Yeah. Joseph will see you in, yeah.
Brilliant. Thank you very much. Oh, I didn't understand that.
What explanations you have here? Psychic surgery that you are letting the healer.
Yes. I've just signed a disclaimer for psychic surgery, but I'm not even sure what it is. It's a bit intimidating, but funny at the same time. Okay.
Okay, lay face down on the bed.
Okay.
But where do you get the pain?
Especially here and here. But this area is like.
Okay, God bless you.
What might there?
I don't know, I'm not a doctor.
How does it feel?
Now, my only concern is the love of God within you. I don't attach to your body.
Yeah.
It's not my attachment. I am not the doer of this action. God does the work, whatever's meant to happen for you. But whatever God wants you to have today is you've received, so.
Thank you very
My
much.
pleasure.
Okay. At least it was not cut open. Putting myself in the hands of God was useless. So I'll try my luck in the hands of the NHS. Dr. Saul Berkowitz trained as a conventional doctor, but later chose to specialize in complementary medicine. He has asked the pharmacist to prepare a herbal tonic for my pain.
What we've got are a number of different herbs with different properties together which will help the pain. They're slightly weaker than the orthodox equivalents, but because they're much safer, I'm much happier to prescribe them long term, because the advice from the medical profession is that you shouldn't take aspirin-type drugs long term for back pain because they can cause stomach ulcers. But with herbal remedies, we've got no fear of that at all. Yeah, it's good stuff.
Thanks. Not bad. A bit strong though, but... I heard that there are also physical therapies available in this hospital, but have they actually been proven to work?
Yeah, for instance, let's consider the recent trials of acupuncture. You have a therapy which is twice as effective as conventional therapy when it's directly compared, and the effects last for 6 or 9 months beyond the time that you finish the treatment. However, you can't show that the real acupuncture, as it's called, is any better than the fake acupuncture. In other words, it doesn't necessarily matter where you put the needles. So is that a justifiable treatment or not? I would argue that it is.
That seems to make sense. So why not give it a go?
There's Chinese acupuncture, Japanese style acupuncture, there's Western style acupuncture, there's a style which is called dry needling, particularly for muscle pain, where you don't leave the needles in and you move them around quite vigorously, trying to release muscle fibers.
I see. Oh, sounds like it's going to be really interesting. I hope it's good. I hope it helps. Sorry?
Do you get all hurt?
Not too much, no. But I've heard from people that say it has hurt.
Obviously there's the potential with a needle to cause enough pain that you tighten muscle.
Yeah.
And the idea is you want to relax it, not tighten it.
Yeah,
Sometimes it tightens a bit, you want to don't cause too much pain.
Okay. I'll try to keep it relaxed.
Well, I can feel with my hand on you, I can feel when the muscle tightens, so I can just stop doing it, but there's a nice little break there.
Yeah.
It's a bit of muscle that's causing some of the pain. Yeah. So, we'll do some acupuncture. Anything?
No, that's okay.
Nothing at all. So I've just buried a needle 2 centimetres into your muscle. So if the muscle's normal, you don't tend to feel so much. So now I'll just move it around a tiny bit, see if I can hit.
Yeah.
See, one little spot there. Oh, there we go. And that's how much difference it can make, just a few millimetres in the same muscle. You can go from nothing much to being really very intense. I'll take that out and you can relax.
No.
And we
feel my feet going like...
stretch. A lot of the major vessels are coming down here underneath the coracoid, which I'm going to find.
Yeah.
So this is clavicular head of pec major. Oh. Is that it?
Yeah.
That's all right. Really sore. All right. Good. Do you want to sit up and have a bit of a...
What I basically want to know is if this will cure the whole cause of it, or if it's just the symptom that is better now.
Yeah, acupuncture does treat symptoms very well. It treats muscle pain very well. It can be a part of you becoming symptom-free. But you're over 30, that's slightly over the hill. You're showing signs of wear and tear in some of your joints. That's never going to go back to fully normal again, but that's something you have to live with. When the muscles get tight, things like acupuncture can release them very well. But if they're getting tight because of pain from a joint, then that won't have a permanent effect. You know, you'll have to need that treatment again and again until the joint settles down.
Many patients say they are helped by acupuncture. But all that pain just to be told that I'm over the hill? And to be honest, I don't want to go through these painful sessions again and again if they only treat the symptoms and not the cause.
Now, sometimes you'll feel sensations.
I found Michael, who has a self-developed healing technique he calls lasering.
That's fine.
I'm really intrigued.
Relax your hands. Okay. What are you aware of now?
I'm concentrating on my chest.
Okay. What's it feel like?
Good. Feels describing words. I'm getting good air.
Okay. What I'm going to do now with my eyes, I'm going to scan the body. Okay. What it basically means is I can actually see where all your blockages are in your body's system. It means by scanning your body, I can prioritise the points that your body requires me to work on rather than just working from a textbook approach.
I see.
Okay. Let's turn around to the side.
I don't know why I thought that an energy healer would find the solution to my back pain. But you never know. After all, he might have the magic touch.
Okay. What are you aware of?
This whole area.
Okay, what's that feel like?
It's a good feeling.
Mm-hmm.
It feels comfortable.
What are you aware of now?
Same area is quite... To be honest, I'm not feeling anything from his lasering.
Is it a small area or a large area?
But I feel under pressure to respond to him. It's larger.
Good. When I manipulate these points, it's sending a signal to the brain to activate or reactivate the points that are blocked. When the communication is broken down, the body cannot function in as effective and efficient way as it should. Now, by me working on a scanning level with you, I scan the points that I'm going to work on based on what your body...
How does that scanning work? How do you see something?
With my eyes. It's not a matter of feeling or thinking, it's I actually see. My eyes have been pulled to the blockage points. They're like magnets. And I can use my eyes in a very specific way, which means I can find the primary blockage point in your body. I manipulate that point, I then stretch it. When we release the memory pattern, you don't have the same perception that causes you to react in the way that you are.
I am getting really nervous. I mean, what is this guy doing to me? Some hours later, my back is worse than ever. His Star Trek style X-raying and energy stretching was kind of amusing. But by prodding fiercely into my sore neck with his unmagic touch, he got it totally wrong. I can't go on messing around with my health any longer. I'm not a human guinea pig. I need one long-term solution that works for me. As my pain might come from the joints, a good friend suggests I see an osteopath.
Any old fractures? That one?
No, this one, this side. When I was 5 years old, a car crashed me. Broke my femur and this bone.
Lay on your back now, please.
On my back?
Yes, please. Just push your arm up in that direction hard as you can. Push. Just push your hand down to the floor hard as you can. Good. Good. Bring the arms right up here like this. Push your hands together hard as you can. Push your hands together hard as you can again. Push your hand to the floor hard as you can.
I don't really understand his way of examining me. I just don't want to spend another evening in pain.
Put your knee up to your chest hard as you can. Pop your hand just on there again. And put your knee up to your chest hard as you can. Okay. Just take a deep breath in. And out. So if I put your body into the position it's pulling itself into, obviously you try and keep your body straight so you make sure you're in a straight line. But you've got quite a strong force pushing this part of your chest in, and you can see that it's slightly depressed here, and taking the head off to the right-hand side like this. In order to keep yourself straight, you have to use your muscular system to straighten yourself up like that. So you're basically fighting against yourself. And that will be a direct effect from the trauma that you've had on your shoulder here.
Amazing. That was when I was 5.
So that basically explains the slight twist in the neck and the tightening on in various other parts of your neck. Apart from that, you have fantastic vitality and you're basically in very good condition.
That's good to know. Now, what should I do? What can be done for that?
I will give you one very specific stretching exercise that you would do every day. So if this is fallen forward like this and there's all this connective tissue pulling in like this, then you would literally reverse that like that with a twisting it in the opposite direction, and then use deep breathing to change the pulling of the fascia like that. And you have to hold it for more than 15 seconds because that's how long it takes fascia to release.
Yeah.
Then I would say after 2 weeks, there'll be less of a pull down like this, which would mean that the left-hand side of the neck doesn't have to crank you back up straight again.
Yeah. Okay. Brilliant. Oh, thank you very much.
That's what I would do with you.
That's good. Thank you very much. I will do that. Conventional medicine could not help me, but complementary medicine had no quick fixes either. After being told that I'm over the hill, that my pain is in the hands of God, and that my body is blocked, it is a relief to finally get a diagnosis I think I can trust. I'm still not entirely pain-free, but after 8 weeks of doing the osteopath's exercises, my back has improved.